Gonna tell you off the bat, I'm gonna get a little hot and bothered in this one, all right? Gonna fly off the handle a bit. And for that, I am sorry. But I gotta do it. I got stuff to say. Feel free to judge. Get upset with me if you want. I don't really care. All right, here we go. So, what is he about to say? Anyway, so when I was in dental school, I took several classes in periodontics. That means the study of the tissues surrounding the teeth. This means surrounding the gum tissue, the bone, the stuff that holds teeth in our jaws. They were interesting classes. You know, I actually toyed with the idea of specializing in periodontics at one point. I have opted instead to specialize in YouTube and TikTok. So we'll see what happens with that. It's going great so far. But yeah, I have great respect for periodontists. I want to say that up front. You're very impressive people, much more impressive than me as far as any dentisting goes. But something about that class really ground my gears, and I gotta talk about it. If you don't know, dentists, we often get called like not real doctors or whatever, like medical school rejects. I don't know if that's true, maybe it is. I think most dentists go to dental school for very specific reasons that have very little to do with having wanted to go to medical school or whatever. There's very large differences between the medical infrastructure in this country and the dental infrastructure, and frankly, I think dentistry gets it right much more often than medicine does, you know, in terms of how it functions as a healthcare system from a macroeconomic perspective. Totally different discussion, totally different debate. Unfortunately, I do think dentistry is heading the way medicine has gone, so I don't know how much longer that will be the case. But anyway, we're gonna stop talking about that. The reason I bring up those things, the point for this video is dentists can kind of have a chip on their shoulder because people don't think they're real doctors, whatever that means. Like, I'm not a neurosurgeon or a cardiologist, but I don't know, how different is dentistry from dermatology? You know, like, are those, I don't know, I'm not trying to throw shade at dermatologists, but it's just a weird debate. My point would be there are plenty of people who work in all sorts of professions who are much smarter than doctors or dentists. But the reason it can be a problem, you know, though, is like people, you know, patients can be sort of dismissive of the importance of taking care of their mouths. You know, there's an attitude that teeth don't matter as much as the rest of the body. And I think the proof of that is that lots of people are very casual about losing teeth. You know, lots of people don't care about their teeth. Maybe that has something to do with a perception of dentists as not being of the same quality as like a real doctor person. I don't know. I think there's a lot of other factors that are more important. Nevertheless, you know, dentists like myself, we've invested like too much into this tooth business. So we have a tendency, unfortunately, to take that all a little personally. All right, I'm gonna have a point here if it seems like I'm rambling. So I'm taking those periodontology classes back in dental school, and the professors keep talking about the oral systemic connection. Ooh, what a buzzword. Oral systemic connection. Oral systemic connection. They keep bringing up studies about how oral health, the health in our mouth, can impact the health of the rest of the body, because the rest of the body is what people actually care about, right? That's where the serious illnesses are that the real doctors take care of. That's what we need to be careful with. That's what we need to pay attention to. You know, they would put up slides up in front of the class talking about how periodontal disease contributes to heart disease and strokes and diabetes and low birth weight. That's if, you know, if moms have gum disease, then their kids are born underweight. All the dental students would ooh and ah about the seriousness of catastrophic gum disease for ruining people's bodies with excess inflammation. No, not excess inflammation. This isn't just about gum disease. This is real serious stuff. Here's the problem though. When I actually looked into what the studies were saying, they weren't saying what my professors were saying they were saying. You know? Like, when you're looking at any scientific study, you need to evaluate whether it is showing a relationship of correlation or causality. Correlation is when two variables move in an identifiable way in relation to each other, right? The relationship could be a negative or a positive correlation. For example, a study could show that patients with gum disease also tended to have more heart disease. Those variables would be positively correlated. As A goes up, so does B, right? Negative correlation would be the opposite. As A goes up, B goes down. However, it is critical to understand that correlation does not equal causality. Just because two variables co-vary, that does not guarantee that they are influencing each other. There could be a third factor, variable C, that is influencing the behavior of variables A and B. That's why to establish causality in a relationship, you need a controlled experiment that holds everything else the same except for a single variable. Then you can see what that variable actually does. Controlled experiments are very hard to pull off. They're complicated, especially when working with humans and diseases. It's just expensive and difficult to do. But anyway, I was taking a statistics class that was telling me about all the common errors people make in the interpretation of scientific studies, and then I was watching another department at the same college make all of those errors and teach us a bunch of unproven facts that were not facts at all. They weren't really verified. More research was clearly needed. These studies had not established causality, but they were presented as if they had. And I'm not trying to be too harsh, but it was obvious to me that these things were being said to motivate people to take dentistry more seriously and to get patients' butts in chairs for dental treatment. And to me, it's doing it in a way that is not honest and is not truthful and is not the way I would want to be treated if I was a dental patient. To me, the obvious underlying motivation wasn't primarily patient well-being, putting the patient first, but rather a way to inflate the importance of dental visits in the minds of patients. Maybe you think I'm being too cynical. I don't really think I am. I was talking to a recent grad at a football tailgate. He was a couple years out of school ahead of me, and he was bragging about how he tells patients they're going to have heart attacks if they don't get their teeth cleaned. Yeah, that's probably going to get you to show up for a dental cleaning, but this is based on very flimsy data. And in case you think that's some kind of isolated incident, trust me, this has come up in many contexts that I've experienced in the dental world. I've sat in on more than one continuing education course where marketing people in the dental sphere emphasize similar advice as a means of getting patients to come into offices for treatment. I've interviewed for jobs at offices that give scripting that tells you to say these things to patients. I did not choose to work at these places. Teaching this stuff in an inaccurate way has real-world consequences. And I think in this case, it's pretty messed up. You could try to make an argument that tricking patients into treatment is ethical because they need the treatment to keep their teeth and gums healthy, and they don't fully understand that. So by telling them that they could have a heart attack, it gets them the dental treatment they should have if they wanted optimum oral health. You could make that argument. I just completely disagree, though. Ethically, it's not my job to decide for a patient for them that they need optimum oral health. That's their choice, right? I don't get to trick them into doing what I would do if I were them. I don't really care how lofty your intentions are. It's still a lie in the end. You're still breaching trust. And to me, trust is the bedrock of any patient-doctor relationship. If we aren't making sincere, honest efforts to give patients truly accurate understandings of their health conditions in a way that lets them make informed choices, we're failing as healthcare providers. I don't think that's really negotiable. You can come at me in the comments. I'm sure some people don't like that, and they've got plenty of arguments against me, and that's fine. That's all valid. Yell at me. And that being said, I acknowledge that it's really hard to communicate nuance about treatment to patients. We do have a lot of jargon in our profession that can be hard to understand, like language that's dental specific. I'm sure people, when I'm making my YouTube videos, don't understand everything I'm saying, which is why I'm always like, please ask me questions in the comments because I want to get better at clarifying things. Also, we cannot predict the future perfectly. Like everything in life and healthcare consists of probabilities. We want to give patients accurate information, but despite our best efforts, we can't do that perfectly, all right? I'm not saying you can give patients perfect information. However, you have to make a good faith, honest effort. And I don't think we're doing that the way we talk about this whole oral systemic connection thing. The fact is, we do not have credible evidence that gum disease leads to increased incidences of heart attacks. And telling patients that that is the case is wrong. Like, just wrong, unethical, unacceptable, wrong. We shouldn't be doing that. Full stop. Even if you help a patient by convincing them to get treatment in this way, maybe the treatment was needed for other reasons, that's still a violation of trust. Like, why do you think so many people distrust healthcare providers and other scientists and intellectuals? Because they can point to the fact that we have told a lot of lies over the years, and in a lot of instances, we have done this knowingly. We have all been prey to the same prejudices and biases of all the other people we look down our scientific noses at. We're not any better than anyone else. The biases of journals to publish positive results over negative study results is well documented. The human desire to be considered important and brilliant and inflate our personal egos biases the science. It pushes us to bend the truth. We do this all the time. It's kind of gross. Why should anyone trust us, right? If we're not going to behave any better than the average run-of-the-mill politician, right? We can't sit up on our high horse and then not actually follow the rules of science. We're also pretty awful at admitting when we get things wrong, If you want to call yourself a scientist, then follow the scientific method. That means humility, right? We are wrong all the time. We mess up all the time. I'm wrong all the time. I mess up all the time. Eat your humble pie. That's what real scientists do. We aren't masters of the universe. We're fragile apes floating on a rock through space. We can't waste time lying about what is true, all right? We need as much truth as we can get to successfully navigate life, all right? It's hostile out there. I don't know if you've noticed. Lies mislead people so that they don't take the right actions to take care of themselves, right? We need to hold ourselves more accountable. That's another reason why I'm doing this YouTube thing, is I can spew all my thoughts out there, and then you guys can tell me which one of them are wrong ones and good ones, and I can try to get better, right? So, hold me accountable. Make me eat some humble pie. All right, so now that you agree that I'm a crazy person who is way too hyped up about this, I am happy to report that the American Dental Association has started to acknowledge that we have a problem within our profession in regards to this whole oral systemic connection propaganda thing. These statements are from the American Dental Association. I'll put a link to this in the video description if you want to read more of it. Although a number of studies control for confounding factors and have found independent associations between periodontal and systemic diseases, establishing causality remains elusive, and the efficacy of periodontal treatment on a systemic condition cannot be posited without interventional studies and randomized clinical trials. Without such evidence, implying that periodontal treatment may reduce risk of a systemic disease would be incorrect and misleading. As stated in a 2013 editorial in the Journal of the American Dental Association, telling our patients that periodontal infections cause a plethora of non-oral diseases and conditions cannot be supported by existing evidence. At this time, there is insufficient evidence that periodontal treatment should be encouraged or provided solely on the basis of preventing future onset of any systemic disease. So I think that makes the point pretty well and pretty clearly. There was another editorial written in the Journal of the American Dental Association in January of 2022 that emphasized these same points, because apparently the profession still hasn't gotten it through our heads. So I'll go ahead and read some from that editorial here as well. In the latter part of the 20th century, peer-reviewed research began to appear documenting the co-occurrences of periodontal disease and several serious medical conditions, including cardiovascular disease, stroke, diabetes, respiratory disease, and poor birth outcomes. Erectile dysfunction. If I titled this video Gum Disease, the real reason you can't please your wife, it would probably get a lot more clicks. Obesity, cognitive decline, rheumatoid arthritis. Articles began to appear regularly in the lay press aimed at a public often poorly equipped to make sense of the science. The sheer volume of the research led some to interpret this literature as settled science, implicating periodontal disease as causally linked to the initiation or exacerbation of these many serious medical conditions. What can often be lost when confronted with such an ongoing flurry of confirmatory studies is that most research is based on similar study designs, and thus they share the same inherent limitations in what conclusions can be made regarding the importance of the results. Many incorrectly extrapolate that a causal relationship exists between periodontal disease and the many and varied medical concerns. Correlation does not imply causation. Just because two things are found to covary, that should not automatically be interpreted as evidence that one is causing the other to occur. Correlation plays a central role in any argument for causal association, but correlation alone is insufficient proof that a causal association exists. Other supporting evidence is required. And you can look up the Bradford-Hill criteria. They talk about that in here. The Bradford-Hill criteria is a whole bunch of, it's like a checklist of things that something needs to meet in order to be as close as we can get to scientifically verifying a causal relationship. That's what that's about. You can look that up. This video is long enough. Some of the Bradford-Hill criteria include biological plausibility, dose-response gradient, temporality, did the exposure precede the outcome, magnitude of the effect, and then the article talks about risk ratios and odds ratios. This is getting into the statistics of how you interpret a scientific study. And then the article basically talks about how the risk ratios for, periodontal disease causing all of these other conditions are quite low in these studies. They barely maybe meet the criteria where you could be like, oh, maybe there's a causal relationship here. But they talk about how, for instance, in all the observational studies that were done on how smoking causes lung cancer, the risk ratios were way higher. And so you could much more confidently suspect that correlation was causal. And then they talk about how meta-analyses of observational studies should not be a prominent component of systemic reviews on this topic, as one will obtain a precise, often spurious result that is at a high risk of bias. So basically, if you just collect a whole bunch of observational studies that are all trying to say that periodontal disease, causes this problem, stacking up all of those individual studies that aren't really that valuable doesn't all of a sudden be like, oh yeah, this is definitely the conclusion. I don't know if you guys have seen The Big Short, but where, Ryan Gosling is doing the thing with the Jenga, and he's like, well, if we just stack up all of the bad investments, then it's a good investment. That's basically what they're saying happened with a lot of these studies. They're like, well, none of these studies actually say what they say, but if we put them all together, maybe they say it. No, it doesn't work that way. So just don't let anyone tell you that your arm or leg is going to fall off if you don't get your gums cleaned, all right? You might lose a tooth. That could happen, all right? You might lose a whole bunch of teeth, all right? That is a thing that happens, all right? I see lots of people that lose teeth because of gum disease. I think it's best to prevent that. I want to help you prevent that. But I don't want to have to lie to you to do it, because I think violating trust between people is way more damaging than any positive benefit of you paying me to get your teeth cleaned. I think we need more trust and transparency and honesty between people in the world. That's why I like YouTube. If I lie about something, you can all call me out on it and blast me for it and ruin my life. Cancel me. That's what I want. Because I was unworthy. And other people can make other videos with more accurate, better information than I was able to produce, And then everybody gets a little bit smarter and more well-informed gradually over time, right? They can make better choices for themselves in life, and that's the goal. That's what we're striving for. That's the majority of the info I wanted to share in this video. I'm gonna add one more wrinkle to the ethics of all of this. You wanna stick around. I said earlier that I recognize that it is difficult to communicate accurate information to patients. That's one of the reasons I started this YouTube channel. I want to get better at informing patients and helping them turn that information into positive action that makes their life a little better. Here's another tricky aspect of all of this. The way we present our information has ethical implications. If you've ever read Daniel Kahneman's book, Thinking, Fast and Slow, you know this. The way we frame the information we present to patients matters. For example, if I tell a patient that a procedure has a 90% success rate, they are more likely to have that procedure than if I tell them that it has a 10% failure rate. That's the same information, right? But people don't react the same way when they hear it presented in those two slightly different ways. less people will have the procedure if you say 10% failure compared to if you say 90% success. So, which way should you present the info? That's a complicated question. I've sat in on other dental marketing lectures that tell you how you should present information to patients so that they are more likely to select the treatment option you prefer, right? If you give them a set of choices, there's a way to get them to select the one more often that you would want them to have. Changing your order of presentation can have an effect on this. There's a psychologist named Robert Cialdini who studies marketing and wrote a book back in the 80s called Influence, and that discussed all the subtle ways you can get people to do what you want without them knowing you're subtly influencing their choices. So what are you supposed to do with that information? How are you supposed to ethically do your job if the way you structure your sentences and the emotional state you prime the patient to be in all influence their ultimate decisions? Like, is that underhanded and evil? Like, are you a manipulative psycho if you nudge someone toward making a decision you would prefer that they make? Here's my shortcut. What would you do for your mom or dad or brother or sister or friend or friend's mom or dad or brother or sister? What would you do for your wife or husband or son or daughter? What would you do for yourself? It's the golden rule, treat others as you would want to be treated. Or even better, the platinum rule, treat others as you would want to be treated if you were them. If you were in their particular circumstances, if you really take the time to listen to what they need and understand what's reasonable for them, for where they are, in life right now, what's best for them. That takes the guesswork out of it. It's not complicated anymore. Your conscience is gonna spit out a pretty accurate answer most of the time. You just gotta listen. Don't violate your conscience. Do the right thing. And by the right thing, I mean, get angry at me in those comments. Bring it on, baby. Get mad. No, there's other valid opinions out there. I'm not the final word on any of this. So seriously, do give feedback in the comments. Be like, oh, what about this? You didn't think about this, Mr. Smarty Pants. Maybe this should have been discussed. I think that's all cool. Talk about it. Have a good day.